Open your medicine cabinet right now. A bottle of ibuprofen, a half-used tube of neosporin, a package of Band-Aids, a cough syrup you bought when you had the flu in 2023 and never finished. To anyone who lived before 1900, this little cabinet is a God's pharmacy. Things in this cabinet would have saved millions of lives. But to your ancestors, getting sick was almost always a death sentence. Almost. What they did when it wasn't, when they actually figured out how to keep someone alive, is something most people alive today don't know about and don't believe when they hear it. Go back 3 million years. Your earliest ancestors lived in groups of about 30. They had no antibiotics, no surgeons, no anesthesia. When you got sick, you fevered. You crawled into a corner. You died. Your body fed the hyenas. The most common cause of death wasn't old age. It was a broken bone that broke the skin. Compound fractures killed about 70% of the people who got them because the bacteria got in faster than the body could close. But somewhere in the dark, maybe 100,000 years ago, somebody figured out the first thing. A tree could stop pain. Willow bark. You strip the inner bark in spring when the bitter compounds peak. You chew it raw. It is so bitter your eyes water. But within an hour, your fever drops. Your headache fades. Your aching joints loosen. Sumerian clay tablets from 4,000 years ago list willow leaves as a remedy for fever. The Egyptians wrote it into the Ebers Papyrus around 1550 BC. The Greeks noted it. The Romans noted it. The Chinese noted it independently. In 1828, a German chemist named Buchner isolated the active compound. He called it salicin. In 1897, Bayer turned salicin into something stable. They called it aspirin. Every aspirin you have ever swallowed is the same molecule. Your great-great-great-great-great-great-grandfather chewed off a tree. Your body still uses the same liver pathway it used 4,000 years ago. And it gets stranger. For open wounds, they used something even older. Honey. The Ebers Papyrus, 1550 BC, lists honey as the primary wound dressing. Open the wound. Pack it with honey. Wrap it in linen. It looked superstitious. It wasn't. The sugar concentration pulls water out of bacteria by osmosis and kills them. The low pH stops them from replicating. And when honey meets wound fluid, glucose oxidase produces a slow drip of hydrogen peroxide. That keeps the wound clean for days. In 2007, the FDA approved Manuka honey as a wound dressing. The active compound is the exact same one Egyptians smeared on injured slaves. The Manuka honey at your local pharmacy is a 3,500-year-old medicine. And it gets worse. When the wound was already infected, already rotting, they used maggots. The Mayans figured it out. Aboriginal Australians figured it out independently. French battlefield surgeons noticed in the 1500s. American Civil War doctors noticed too. They watched wounds with maggots heal faster than wounds without them. Here is why. The larvae of one specific fly, Lucilia sericata, secrete enzymes that liquefy dead tissue. They eat the rot. They do not eat living tissue. And they secrete antibiotics, defensin, lucifensin, that kill the bacteria the rot was feeding. A maggot triples in size in 48 hours. You replace them every 2 or 3 days. The FDA cleared maggot debridement therapy as a medical device in 2004. It is currently used on diabetic ulcers in American hospitals. The maggots that healed a Bronze Age axe wound are the same maggots in a sealed sterile mesh on a diabetic foot in Cleveland tonight. The Egyptians had another one. Mold-rotted bread. The Ebers Papyrus recommends it for rotten ulcers. You take stale bread, you let it sit until the mold blooms green and blue. You mash it into a paste. You pack it into the wound. The mold genus is called penicillium. Alexander Fleming discovered penicillin in a London lab in 1928. The Egyptians had been pressing the same mold onto infected wounds for 3,500 years. Every antibiotic you have ever taken is a refined version of something the Egyptians scraped off bread. And what came next is the part that doesn't sound real. In the Andes Mountains of South America, starting at least 2,400 years ago, ancient surgeons did something almost no one believes when they hear it for the first time. They drilled holes in living skulls. The procedure is called trepanation. They strapped the patient down. They peeled back the scalp. They scraped a slow trench in the skull bone with a tumi, a small ceremonial blade. Not drilling, scraping, grooving carefully in a circle, deeper and deeper, until a disc of bone lifted out. The patient was conscious. The bone has no pain receptors, only the membrane around it does. For mild pain control, they chewed coca leaves. Then they put the disc back. Or sometimes they didn't. The scalp was stitched closed. Most of them lived. A 2018 study at Tulane University analyzed 800 trepanned skulls from the Andes. The earliest period, 400 BC to 200 BC. The survival rate was about 40%. By the middle period, around 1000 AD, it was up to 53%. By the Inca period, the 1400s, the survival rate was 80 to 83%. For comparison, American Civil War battlefield surgeons doing the same procedure on the same kind of patient 400 years later, 50%. Inca surgeons were better at brain surgery than American doctors 400 years after them. That is not a metaphor. That is the math. And it gets worse. Before any of this, before Inca trepanation, before the Mayans found maggots, before Greek physicians, before Hippocrates, someone in Egypt sat down with a reed pen and wrote the first medical textbook in human history. It is called the Edwin Smith Papyrus, a copy of an older text, possibly 5,000 years old. It contains 48 surgical cases. Each one follows the same structure. Examine the patient, make the diagnosis, give the verdict, choose the treatment. The word brain first appears in this text. The earliest written description of the meninges, the membranes around the brain. The first known account of pulse taking. And in case 6, they describe a man with a compound skull fracture, brain matter visible through the wound. The physician writes, an ailment not to be treated. This is the first hospice judgment in recorded history. 4,000 years ago, in Egypt, someone first wrote down the hardest sentence in medicine. Sometimes the right answer is to stop. But there is one thing ancient humans did when they got sick. That has nothing to do with willow or honey or maggots or moldy bread or skulls or papyrus. In 1957, an American archaeologist named Ralph Solecki started digging in a cave in Iraqi Kurdistan called Shanidar. He found 10 Neanderthal skeletons. One of them, the one we call Shanidar 1, told a story no one expected. The left eye socket showed a healed, crushing fracture. He had been blind in his left eye since he was a young man. The right arm had been amputated at the elbow. The amputation had healed. He could not have hunted. The right leg was withered. He had limped, probably with a stick. He had severe arthritis through his spine. Several of his teeth had fallen out. And in 2017, Eric Trinkhaus and Sebastian Villot discovered something the earlier studies had missed: bony growths in both ear canals, exostoses. That would have caused profound deafness in both ears. Blind, deaf, one-armed, limping, toothless, arthritic. He could not have heard a predator. He could not have run. He could not have hunted, foraged, fought, fled. He lived to 45 years old. The Neanderthal average was somewhere in the 30s. He outlived most of his able-bodied peers. In a society with no antibiotics, no agriculture, no permanent shelter, no soft food, there is exactly one way this happens. Someone fed him. Someone softened his food. Someone watched for predators while he slept. Someone amputated his arm without killing him. Someone changed his bandages. Someone kept him alive for 30 years. This wasn't kindness. It was a 100,000-year-old social technology we are still trying to understand. And Shanidar 1 was not the only one. Of the 5 adult Neanderthals at Shanidar, 4 had healed traumatic injuries from before death at La Chapelle-aux-Saints in France, the famous old man Neanderthal. The arthritis was so severe and the tooth loss so complete he could not have chewed his own food. Someone in his group prepared softened food for him. For at least 100,000 years before the first city, before the first farm, before the first word was written down, the species we call brutish, the species we call primitive, was keeping its disabled alive. Every time you reach for an aspirin tonight, you are reaching back 4,000 years. Every time you put honey on a sore throat, you are using the same antibiotic the Egyptians used to embalm their dead. Every time a hospital uses maggot therapy on a diabetic foot, they are using a treatment a Mayan healer figured out 1,000 years before any of us were born. Every time you take an antibiotic, you are taking a refined version of something an Egyptian healer scraped off rotten bread. Medicine is not new. Care is not new. It just got faster. And every time someone you love is sick, and you sit by their bed, and you bring them water, and you change the dressing, and you stay through the night because they are afraid to be alone, you are doing what a Neanderthal community did for a deaf man in a cave 50,000 years ago. If you took a modern human and dropped them into a Neanderthal community with a compound fracture, no antibiotics, no surgery, no clean water, they would probably die in days. But if you dropped a Neanderthal into your hospital tonight, the first thing they would recognize wouldn't be the machines, not the IV, not the heart monitor, not the white coats. It would be the people, the ones bringing water, the ones changing dressings, the ones sitting beside someone's bed at 3 in the morning, the ones who decided you were worth keeping alive. For 50,000 years, that has been the only medicine that ever really mattered, and it is still the one we forget to count.